Hello, everyone.
Hi.
Welcome.
Thanks for joining us.
Thank you for having me.
Hey folks, we're just giving everybody a moment to kind of join with us. While you are waiting, I would like to share this slide with you about how to get started with Zoom. Let's see here. So if you see my slide, let's see. And feel free to ask any questions. You can send your questions directly to me. My name is Audrey and I'm on the Action Team C4 box here. So if you go to your chat, you can chat with me privately if you feel more comfortable doing that way, or you can message everyone and then your question will go to everybody. But I am here to help with any technical issues. So you can just let me know. I'm looking at this and I'm realizing that this was from a previous meeting, so there might be some things on this etiquette that we might go ahead and let folks ask their questions out loud versus asking them through the chat. So just know we're kind of asking you to mute yourself when you're not speaking. But if you have any tech questions, please feel free to message me. And I will help you out. All right. And so just to quickly reiterate, you are muted, you're all muted, but your video is on so we can see you. Just know if you have some issues, if you do want to ask a question and you're having trouble turning your mic on and on, we have the ability to turn your mic and your video on and off for you. So if you forget and leave your mic on, we may turn it off for you if we're hearing feedback. If we do see that, you know, like for instance, if you forget your video is on and you come in and somebody bursts in on you, we can turn your video off. So just know we'll kind of be aware of those things and we don't want anybody to be embarrassed. If you want to mute yourself or turn your video on and off, those buttons are in the lower left-hand corner, so you can turn that on and off that way. To see, we do ask if you can't see the participants box and the chat box, to go ahead and turn those on. If you go to your features, they're kind of in the middle area, so click your chat and your participants, and that will show you the chat that everybody has. And then you can also use the raise your hand feature if you want to raise your hand for a question, and that will let us know to call on you so that you can ask your question out loud. And just be aware, like I said, of when you are chatting with each other privately. And maybe you see your friend and you want to say hi, just know, like, just be mindful of who you're sending the message to, so that you're not sending the message something to somebody that you know you don't want to. So just keep that in mind. My name is Audrey Gomez. I am the Education Director for C4 Atlanta. I'm going to turn off my screen share here for a minute so you can see my face. My name is Audrey. I'm the Education Director for C4 Atlanta. I've been with C4 for about 5 years now almost. And also on the line today is Jessica Holland. She is our Executive Director. I'm going to let her just say hi really quickly if she's here. I think she dropped something into the chat.
Oh,
Hi, thanks for being here, everyone. I am here sort of in a lurking capacity. I know that you are in great hands today, and thank you so much to Amir and Renata for being here and doing this session. This is a great community, our arts field, and so happy to have you here. Thank you.
Yeah. And so this is one of two COVID-related workshops that we're doing this week. There's another one on Friday with another member of the Actors Fund, Rebecca Selko, who's doing one on personal finance during crisis. But we wanted to share these workshops so that we could talk about issues that artists were facing with COVID, things like losing insurance through a job or having their income reduced, and kind of answer some of those questions that we know folks are really concerned about. I'm going to let our two facilitators introduce themselves. We have Renata Marinaro, who is here from the Actors Fund, and Amir Jones, who is with the Health Initiative, which is right here in Georgia. So I'm going to let them go ahead and introduce themselves and talk about what we are going to be learning about today.
All right, thank you very much, Audrey. And hello, everybody, and thank you so much for coming. We are going to turn you all into health insurance ninjas during this next hour and 30 minutes. So we're going to talk about vocabulary. We're going to talk about regulations. We're going to help you understand how to re-estimate your income now that it's possibly changed, how to lower your premiums, who's eligible for what do you do if you're uninsured, how do you get medications. We're going to talk about COVID testing and treatment, who pays for what, all that kind of stuff. So we're going to go over a lot of different things. I so appreciate C4 allowing us to do this and reach out to everybody. Just a little bit about the Actors Fund. So we are a nonprofit national organization with headquarters in New York and offices in Chicago and LA. Right now we do a lot of financial assistance. So if you go to our website, actorsfund.org, you'll see a banner on the top for people to apply for financial assistance online. Our grants right now are $1,000. We just helped somebody from Atlanta the other day, a local 600 member. So we are very aware of the devastating impact of this on the arts community, and we are definitely here to help. And a little bit later, there's a slide where we talk about the Actors Fund, and I'll just do another brief little thing, but I want to let Amir talk about the Health Initiative now too.
Great. Great, thank you. Good afternoon, everyone. As it has been said, my name is Amir, and I work at the Health Initiative. We are located in Candler Park, which is not too far from Decatur or the Little Five Points area. We're also very convenient to MARTA, so please know that if you have folks that are in need of any of our assistance, they could very well use the train to get to us as opposed to driving us. Many of you are aware parking can be a challenge here in the city. The Health Initiative is a referral resource primarily in that we offer enrollment assistance, cultural competency trainings, things of that nature as it relates to queer and trans folks living in the state of Georgia. Our enrollment assistant team is 4 folks that have been working on open enrollment and special enrollment periods for a number of years now. So we have a wealth of knowledge and potential resources to share with people about the ACA, as well as general health insurance nuts and bolts. There's another slide that talks about who we are and what we do, but that is our primary role and function. We're housed in the Rush Center, and that is near where Radial Cafe used to be. If you wanted a point of reference, that now is Lazy Betty is the name of that restaurant. But again, we are actually in the Rush Center facilities. Oh, and thanks for having me.
All right, so Audrey, is there anything else or should we get started?
Yeah, I just want to say one more thing, which is I know Renata mentioned the resources that the Actors Fund has in terms of emergency resources. C4, we have an Artist Lost Gig Fund. We are doing grants up to $500 for folks who've been affected by lost work. And that fund, you may see, we've kind of gone, it comes open and we cut it off as we're kind of getting new donations in. We try and donate that money right back out. So if you go to it right now and it's closed, just know we usually post through social media when it's back open, when we've gotten more funds and we can allot those. So we have that resource locally as well. But yeah, I think we're ready to get started.
All right, awesome. So I'll just pull up the presentation. So can everybody see the screen? Should say COVID-19 concerned. If anybody can't see that, just raise your hand. Everybody's good. Okay, awesome. Okay, cool. All right, so so here's our information. That's my email address. Amir, did you want to give people your contact information too?
Sure, absolutely. The telephone number in the office is 404-688-2524. My extension is 120. Again, that's 404-688-2524, extension 120. My email address is amir@thehealthinitiative.org. And at the end of the presentation, we can also share that once again. Email clearly, because everyone is working virtually, makes the most sense, and as such, email is the best way to get a hold of me right now. And again, that is amir@thehealthinitiative.org.
Awesome, thank you. And I just saw that Audrey posted it in the chat too.
Great.
So thank you so much for that. All right, so Amir, did you want to do this slide, or have we pretty much gone over everything?
Let me see. Let me just highlight one point. I talked a bit about who we are and what we do at the Health Initiative, and I'd like to share with y'all that when people use the term enrollment assisters, they could mean a couple of things. They could be talking about an insurance agent or a broker. They could also be talking about a certified application counselor, or they could be talking about a navigator. So with a navigator or a certified application counselor, those folks do not receive a commission for their services. And those individuals also too do not charge you a fee for their time. So know that with an insurance agent, they're coming from a particular perspective as it relates to talking about health insurance options. And for us at the Health Initiative, we do not do that. It is our main objective to offer information about concepts, the ability to navigate the website if you have trouble filling out your application on your own, as well as just general how-tos as it relates to the exchange. So that's the main thing I'd like to say about that slide. Thank you.
Awesome, thank you. So so the Actors Fund also does enrollment assistance, same as what Amir talked about. We are navigators, and in New York, it's called certified application counselors. So we don't accept any money for the services. I would encourage you guys, if you're local, to talk to Amir for any enrollment services, but just know that the Actors Fund does have enrollment assisters in New York and California, and we do offer information nationally. So you can call our main phone number, which is 917-281-5975. That's 917-281-5975 for any kind of health insurance questions. If you're outside of Georgia or you have friends that are outside of Georgia, please refer them to that number and we're happy to help. The Actors Fund also has 4 other areas that they help in: social services and financial assistance, the Career Center, which helps people find sideline work, health and health insurance, and housing. So I'm the director of health services. We do have a health center in New York City that is just for people in the performing arts and entertainment. It's in conjunction with Mount Sinai. And our goal is to help create educated healthcare consumers. So in case you haven't noticed, this is not a nonprofit healthcare system. Our system is a for-profit healthcare system. And so the best way to understand your place in it And the best way for you to get the most bang for your buck is to be an educated consumer. And that's really what we're going to do today, is really help you understand the language, the regulations, help you figure out what would work best for you. We're not here to tell you that. We're here to help you understand how to figure that out. Help you see if you're eligible for any kind of special programs, and then again, help you understand how to get care if you're uninsured. So please check out theactorsfund.org. There's a ton of information on our website. We do a lot of online workshops right now, particularly with the Career Center. The financial wellness workshop that's coming up with C4 that Rebecca is doing, she's fabulous, by the way. And I would really encourage anybody to sign up for that webinar. And so she's working in conjunction with the Career Center and Social Services to help people understand how to budget during this pandemic. So, okay, so we're going to go over some basic words to know. After each section, we're going to stop and ask you guys if you have any questions. And I think it's important because this builds on itself. So if you don't understand the basic terms, it's going to be a problem down the road when we're talking about some of this stuff. So we're going to stop. We're going to ask you if you have any questions. At that point, please unmute yourself. Or if you want to put the question in the chat box, Audrey can let us know that there's a question in there, because it's kind of hard for us to look at the chat box while we're presenting. So, so there's two ways to do it. You can either unmute yourself and ask the question, or put it in the chat box. All right, so so basic words to know. So most people know what a premium is. It's like a subscription to your insurance. Essentially, you're paying every month, or sometimes if you're a student, every semester, or if you're in a union, every quarter, just to have health insurance, right? A deductible is what you pay up front before your coverage kicks in. So this is kind of a weird concept. It's basically health insurance companies shifting costs onto the consumer. So if, for example, you have a $500 deductible and you want to go to the doctor for the first time on your plan, and the doctor charges, let's say, $149 sort of retail for an office visit, you're going to pay that $149. And then if the doctor says we need lab work to figure out what's going on with you, and the retail cost of that lab work is $251, you are going to pay that cost. Now you're at $400 out of your $500 deductible. If you go to the pharmacy and the pills that they prescribe for you cost retail $100, you've now paid $500 out of your own pocket for any kind of medical services, and you've satisfied your deductible. Okay, so you've met or satisfied that deductible. And now when you go back to the doctor for a follow-up visit, you're not going to pay the full cost or the retail cost. You're going to pay either a copay or co-insurance. So a copay is a flat fee for a service. So a lot of you are familiar with this because it might say on your insurance copay $25 PCP. That means you're paying $25 to see your primary care physician, or $40 for your specialist, for example. Those are flat fees. You actually have no idea what that doctor charges. You just know that you're paying this flat fee. Co-insurance is a percentage of the bill, and co-insurance more accurately reflects the insanity of medical costs, because co-insurance is a percentage of the actual medical cost. So let's say in New York City right now, it costs about $4,000 a night for a bed in a hospital. If you have a 20% co-insurance plan, you're paying 20% of $4,000, right? Which is a lot of money every night for that bed. It's still not the retail cost, but it's still a lot of money. So co-insurance accurately reflects the medical cost because it's a percentage of the medical cost that you're paying. Co-pays are usually a better deal than co-insurance. The out-of-pocket maximum is essentially adding up your deductible, your copay, and your copays and your co-insurance. So the Affordable Care Act basically said we don't want people to go bankrupt in case there's something serious that happens to them medically. So we're going to put an out-of-pocket maximum on all regulated insurance plans. And what that means is every year there's an official federal out-of-pocket maximum, and this year it's $8,150. So if you have insurance that's regulated through the ACA or exchange, you're not paying more than $8,150 per person for medical expenses in a year. And that includes anything that you pay for a deductible. It includes all of your copays and it includes your coinsurance, right? So once you've spent $8,150 out of your own pocket, you're not spending any more in that year. That's your out-of-pocket maximum and you've met it. I have dealt with many people who have been very happy that this out-of-pocket maximum exists because something serious happened to them. We hear stories about the ICUs and how expensive it is to get COVID treatment. So when you have an out-of-pocket maximum, it makes sure that you're not hemorrhaging money in a serious situation. It does not include your premiums, unfortunately. So in-network and out-of-network. So basically there are things called HMOs and there are things called PPOs. So an HMO plan, in an HMO plan, you're going to a network of doctors. It's essentially a list of doctors. And you can go to those doctors, and if you go to them, then your services are covered according to your policy. If you go to a doctor that's not in your network and you have an HMO, you're paying full freight. So you have to make sure that your doctors are in network, right? You want to make sure that you save that money, that you don't end up paying out of pocket because somebody was out of network. There are some plans called PPO plans, or sometimes called POS plans, that do cover doctors out of network. They're generally more expensive, but there are plans that cover doctors out of network. So if you have a doctor that you really, really love and you want to keep that doctor and they don't accept any insurance, you might want to actually go with an out of network plan. Amir can talk a little bit more about what the options are and when that makes sense and when it doesn't. So it's usually a very individual decision though. The market, yeah. The marketplace or exchange, it's the same thing. They're interchangeable terms. In Georgia, it's healthcare.gov. So you're going to go to healthcare.gov to apply for any kind of discounted insurance plans. So basically the benefit to going on the exchange is that the government takes your income into account, and it also provides a bunch of regulations for you. So you know you're getting regulated, legit plans. And if your income goes down, you can get more of a subsidy. And if your income goes up, you're supposed to let them know and you'll get less of a subsidy. So your premiums will fluctuate with your income. If you go off the exchange, that's not the case. So if you buy directly from an insurance company, they don't care how much money you make. They're just going to sell you a plan. It's a standard price. And if you lose your job, too bad, right? But with the exchange, they do care. So that's the difference. The advanced premium tax credit is the subsidy. It's basically, it fluctuates with your income. And if you make a certain amount of money, you would be eligible for a subsidy of a certain amount. And that basically just lowers the cost of your monthly premium. So I'm just gonna stop right there and just see if anybody has any questions about any of this vocabulary right now. Okay, so I see in the chat box that somebody is saying, would you be so kind as to address Medicare? I must make decisions this month and I need guidance on whether to accept Part B. Okay, so this presentation does not include any Medicare information. We're just dealing with health insurance for those under 65 or who are not disabled. But I'm putting in the number of a Medicare expert. She's on our team. Her name is Debbie Kraus. I apparently can't talk and type at the same time, so give me 1 second. So in the chat box, I've listed her name and her direct phone number for any kind of Medicare questions. So Debbie is our Medicare expert nationally, can help you understand what the best option would be for you. So she can help you answer this question, okay? Does anybody have any other questions about any of this vocabulary right now before we move on? Okay, if you do unmute yourself.
I do quickly.
Mm-hmm.
Because of the crisis, can I go back into the marketplace or back to the insurance company, I guess, and lower my plan because I'm at a silver versus maybe going down to a bronze, something like that?
So if you bought a plan through the marketplace on healthcare.gov, yes, you can change your premiums based on your income.
Even though, will we
sorry.
be talking about this later? I didn't want to jump into.
You're fine.
It will be.
We will be. The long and the short of it is that if you already have a plan via the exchange or the marketplace and you have a change of income, that qualifies you for what's called the special enrollment period. And any adjustment to your income, as well as a few other factors in a slide that we'll talk more about, you'll be able to update your income and update your information, and therefore choose choose a bronze from a silver, as you had suggested.
Thank you.
Absolutely.
Great. Any other questions? If you have it, just unmute yourself, okay? All right, great. So we're gonna keep going on.
It's not so much a question, but an add-on to that. Wouldn't that, if your income gets down to a certain lower level, when you change your status for one reason or another during a special enrollment period, aren't you eligible to explore the subsidies, or can you get those at any time? Because the silver plans are the ones that carry the subsidies. So I'm just.
So there's two different types of subsidies. There are cost sharing reductions, and there are also premium tax credits. We have a slide that talks about both of them, but the long and the short of it is, with a cost sharing reduction, if you select a silver plan, that is when that takes effect. A premium tax credit is eligible on any metal level. So that could be on a bronze plan, that could be on a silver plan, that could also be applied on a gold plan should you decide to do so. So in that respect, usually what happens is when people are eligible for a cost sharing reduction, the silver plans are more advantageous, but that very much depends on the individual or with the family. So again, CSRs are for silver plans being selected. APTCs are for any metal level. Does that help, Mike? Excellent.
Yeah, but you will definitely be able to change your income if you've gone through healthcare.gov to buy a plan. And when you change your income, it will change the subsidies that you get. All right, I see we've got somebody, a question. Could Amir please increase his volume? Somewhat difficult to hear. So I don't know if you can do that, Amir.
I will try. Hopefully that's better. I'll also try to project a little bit more.
All right, great. Thank you so much. All right. Okay, and is your microphone, they suggested maybe your microphone is covered. Is your microphone covered or uncovered?
That's a great
We've got
question.
people in the business here, man. They know their stuff.
Where is the microphone? How about that? Because I do not know my stuff.
Okay, all right. Well, then if you don't know where your microphone is, it's probably not covered. It's fine.
Okay.
So.
Well, actually, what you can do is on the lower right-hand corner, there should be, are you on Apple or Mac?
I'm on a PC.
PC, okay. Lower right-hand corner is the volume control, and it looks like a little sideways triangle. And you can click on that, and it'll give you a interface, so you can, with sliders, you can change volumes and that kind of thing there.
Okay, let me try to find
See it down there?
I can actually hear you really well. I'm not, but.
Yeah, well,
Okay.
he's coming in pretty low. I had to turn my volume up to hear him, and now everybody else is a little bit louder, but.
Oh, okay. I'm probably
Okay.
shy.
I'll try.
I
I will do what I can to project. And let me say this sentence and see if that's helpful. So we were talking about CSRs and APTCs. One thing that I'd like to share with folks is that you can still purchase health insurance via the quote unquote old school or traditional or previous methods. And by that, I mean, you can purchase insurance via your significant other's plan. You could also do it through your job. Those conventional methods are still available. However, if you want a CSR or an APTC, you will have to purchase a plan via the marketplace. Was that sentence loud enough, folks? Excellent, great. Sorry for the technical difficulties on my end. Let's head on to the next slide, please. Uh-oh.
Sorry, y'all. As many of you all are dealing with, I think we are all dealing with some internet difficulties. So if you can just wait for just a second, I think Renata may have gotten momentarily kicked off, and she has our slides. So if you'll just give us 1 second to wait for her, I'm sure she is trying to log back in.
Sorry, everybody. I just cut out there. I'm really sorry. So, okay. So continuing on, if that happens again, Amir, feel free to just continue on.
No
So
problem. No
My
problem. Will do.
All right. So, so regulations, in terms of regulations, here are the rules. So you'll know if somebody's violating them. Okay. So, basically, insurers cannot refuse coverage to anyone or exclude pre-existing conditions. Insurers can't impose annual or lifetime dollar limits. In other words, they can't say we're only going to pay $100,000 or $1 million for you. There's no penalty for being uninsured. In most states, some states do have penalties. New Jersey has a penalty, for example, but Georgia does not. And most plans must cover certain preventive services for free, including mammograms, pap smears, colonoscopies, blood pressure, diabetes, cholesterol tests, HIV, STD testing. All of that stuff has to be covered if you're insured, pre-deductible. Okay. Right now, your options, if you're uninsured, are what you see here. So you may be eligible for COBRA. If you were recently, if you recently lost coverage through your job or your union, and we're going to talk about COBRA in a second, you may be eligible for a special enrollment period, in which case you can buy insurance either directly from an insurer, and we talked a little bit about why that's not a great idea if your income fluctuates, or you can buy it through healthcare.gov. You may be eligible for Medicaid. Not many people are, but some people are. And then the bridge program, we have that listed here, but actually Audrey's going to talk about the fact that that enrollment doesn't open up again until the fall. So she'll go into detail about that later on in the presentation. COBRA is a law that lets you keep your coverage through your job or your union for 18 months and sometimes longer. You have 60 days from the date that you lost your coverage through your job to choose COBRA. You have 45 days after you choose COBRA to pay for COBRA. The deal with COBRA that makes it nice is you're keeping the insurance that you have, and if you like your insurance, that's a great thing. The thing that's not so nice about COBRA is it's very expensive. So when you have a job, your employer subsidizes part of your health insurance premiums. Usually it's 50% or more. When you have COBRA, you're paying the full cost for your health insurance premiums. So if some of you, I don't know if any of you are equity members, but if you are an equity member, you're paying $100 every quarter when you have earned eligibility, but you're paying $1,000 a month when you have COBRA. So COBRA can be very, very expensive. For some people, it makes sense. Know that they're generally it's pretty expensive.
Sorry, Renata, if I could ask you to repeat that last bit. I think you cut out for just a moment.
Oh, okay, I'm sorry. So just Cobra is very expensive. It's an option for anybody that has a job. If you, okay, Amir, I'm turning it over to you.
Great. I'm ready.
Let's see, is
Are we
she?
free?
Oh, I
I
think
think
maybe we lost her
okay.
again. Ooh, I'm gonna see if I can pull up her slides here and share them myself. Okay.
While you're working on that, I will begin the first one, which we saw a little snippet of a moment ago. Looks like, is it up?
Give me just one moment here.
Okay. We're on number 8.
Great. Okay. Let me pull up I'm going to go ahead and share the slides from my end, if you don't mind.
Absolutely.
Renata, I saw you joined us back here again. Okay. So,
yes, this is where we are. Excellent.
Okay, great.
So just to give folks a brief overview, there are 2 enrollment periods with the exchange. You have open enrollment, and then you also have a special enrollment period. Open enrollment every year goes from November 1st through December 15th. Special enrollment periods begin after December 15th. So the time that we're in currently right now is our special enrollment period. In a few moments, we'll talk about what those eligibility requirements are for a special enrollment period. But once again, know that in the wintertime, that's our open enrollment period. Medicaid applications are accepted throughout the year. So in that respect, know that there isn't an open enrollment or a special enrollment for Medicaid applications. Yes, so here's a little bit more detail about what an actual special enrollment period is. Know that what has to happen to be deemed eligible is a qualifying life event. These are examples of qualifying life events. They are not all of them. And I would imagine for this audience, what's critical to note is changes of income or losses of jobs are qualifying life events in the event that you've already purchased a marketplace plan. So with qualifying life events for special enrollment periods, it's in my opinion, it's important to note that those enrollment periods have a specific window in which you can apply. Excuse me, you have 60 days to 90 days, depending upon the qualifying life event, to purchase insurance via that special enrollment period. Another notable qualifying life event for a lot of people right now is in the event you've had to move from one state to the next. When the Affordable Care Act was made available, every state had its choice as to how they would enact it. In Georgia, open enrollment, as well as the marketplace process in general, is using the federal exchange. And again, different states will use different things. So if you moved, for instance, from Florida to Georgia or from New York to California, those are examples of another type of qualifying life event. Next slide, please. I mentioned this earlier in our question and answer session that just began, but conventional options are available to apply for as it relates to insurance. The marketplace, however, is the only place where subsidies are actually available to folks. And again, with those subsidies, we're talking about cost sharing reductions as well as premium tax credits. So let's say you think you're eligible for a special enrollment period, or you know that you are. How can you get assistance? Assisters such as ourselves from the Health Initiative are available year-round. So we're more than happy to walk through the process with you should you need that. There is a 1-800 number to apply if you would like to apply for coverage over the phone. And know that this line is available 24/7. So once again, if you are online and there's a snag, or if you're unsure about something, feel free to call that line and they will be able to assist you. There are assisters available throughout the year. Healthcare.gov, which we've referenced a couple of times, is the website portal for the marketplace. And again, please note that with healthcare.gov, that is the website for the federal exchange. It doesn't say anything other than that. And in the event something popped up on your phone, or if you received a text or you're not sure that it's from the marketplace, you will know it based upon the website listed, which is healthcare.gov. Applications can also be done via paper. However, that is the slowest method to complete your application. So note, keep that in mind if you were wanting to actually write out a handwritten application. They are available at most libraries throughout the state as well. I referenced this a moment ago in the beginning of our time together, and I just want to reiterate, enrollment assisters do not receive a commission. All of their services are free of charge. With an agent or broker, however, they may receive a commission or an hourly rate for their services. And with an enrollment assister, one way to verify that they are who they say that they are is on the Department of Insurance website. My name is listed, as are other individuals that have recertified or certified in our state to provide information about the exchange. Next slide, please. I just alluded to this, and the very first bullet point is beware of scams, be them online or over the phone. Typically, prior to the beginning of open enrollment, people will get emails and or text messages and or both about time to re-enroll or to look at their insurance options and opportunities. So once again, please note that healthcare.gov is the only site connected to the federal exchange here in Georgia. Looks like we've got a question in the chat box. Right now, there is an individual by the name of Robert asking a question. Right now, special enrollment period is now. Open enrollment is from November 1st through December 15th, and special enrollment periods last from December 16th up to October 31st. I was talking about scams just a moment ago, and I want to reiterate that personal information should never be given over the phone unless it is a licensed and appropriately credentialed individual. All right. Next slide, please. And before we begin with that, we'll look at the chats. So thank you all for your patience as we go through this. It looks like there's a question about when special enrollment periods are. So just to reiterate, November 1st through December 15th is open enrollment here in the state of Georgia. Special enrollment periods are outside of that time. So we are currently in the window of a special enrollment period. Okay, so are there any other questions actually while we're pausing on what's been covered? Okay, great. So what is actually covered under ACA plans? As you can see, at least 10 of these categories are included on every plan that you will see on the exchange. Hospitalization, emergency services, preventative screenings and wellness exams, all of that is covered under the exchange. I would also add to let folks know as it relates to COVID-19, tests and screenings for COVID are also included at this time under ACA plans, should they be needed. Each insurance provider is doing things slightly different around treatment, but the actual tests are included on exchange-based plans. Next slide, please. A previous question mentioned silver versus bronze, and so know that when you are applying for coverage, every insurance plan is going to be in one of these categories. We have bronze, silver, gold, and catastrophic. Catastrophic plans may not come up for you in the event you were over the age of 30. However, catastrophic plans are available for young adults that are interested in purchasing coverage. These metal levels break down basically the cost that the insurance company pays, as well as the cost of the individual or family that is paying for the health insurance. So with bronze, you have a 60-40 breakdown, silver is 70-30, and gold is 80-20. What I'd like to note about this is every application is different, every individual and every family is different. So in that regard, whether or not bronze, silver, or gold makes sense for you will depend upon your healthcare history and what your goals are for the year. Next slide, please.
Can I just jump in here real quick?
Oh, sure, absolutely. Please
Okay,
do.
great. So just to give an example of a bronze plan versus like a platinum plan, I worked with a stunt man who was young and had a bronze plan, and who were like, you have to have some kind of insurance, and he fell on a wet spot in his kitchen and he broke his ankle, and he was very embarrassed that this was not a work-related accident, that this was actually just him falling in his kitchen. Anyway, he ended up with a $250,000 bill from breaking his ankle because it got infected. He ended up in the ICU for 2 weeks, etc. So his bronze plan protected him in that situation, and it made sure that he only owed, I think at that time it was like $6,900 was his out-of-pocket maximum. So the bronze plan in that situation kept him from going broke for the rest of his life. It's for people who, may not need the healthcare system all that frequently, but want to make sure that they don't hemorrhage money, versus a platinum plan might be more appropriate for somebody who, for example, or multiple sclerosis med, for a baby, or you need a hip operation or a knee operation. In those situations, since you're going to be making frequent use of the healthcare system, a platinum make more sense. That's all I wanted to add.
Great, thank you. These are the actual categories that are on every marketplace application as it relates to what the personal information is that will be determining the cost of your coverage. Please note here, folks, that pre-existing conditions aren't listed. So whether you're completing a marketplace application or if you're just browsing and looking at what's available to you on the exchange, your medical history is not being asked about. The only thing that's related to that is being asked about is whether or not you smoke cigarettes. I will also share that on healthcare.gov, there is what's called a estimator tool. You're able to look at plans that potentially could be worthwhile for you before you complete an application. In that estimator tool, they ask about your household size, they ask about your income, they ask for your geographic location as well as your age. They do not ask about pre-existing conditions, however. Next slide, please. We've touched on this a couple of times so far in this conversation. So if it's okay, I'd like to direct everyone's attentions to the last 2 bullet points. So with premium tax credits, we're looking at individuals that their income is between 100 to 400% of the federal poverty level. For cost sharing reductions, these are individuals that are between 100 and 250% of the FPL, and they select a silver plan. So with respect to dollars and cents, if you are between $12,500, and I'm rounding up, but again, if you are between, as a household of one, $12,500 for the year on the low end, on the high end of 400%, you would probably be around 45,000, give or take, for the year. So if you're between 12,500 and 40,000, roughly.
51.
Thank you. So between 12,500 and 51, you can expect a discount on your monthly premium. Okay, and again, if you are between 12 and 250, someone can help me with the math on that, that'd be great. But again, if you're between 100 to 250 and you select the silver plan, there's additional savings that you are entitled to. Next slide, please.
Okay, so I hope you guys can hear me, and I really hope I don't cut out again. So I'm going to talk a little bit about re-estimating your income and lowering your premium costs. And if for some reason I cut out or you can't hear me, please let me know. So again, you can lower your premium costs if you've bought a plan through healthcare.gov, or if you're eligible for Medicaid. And again, few people are eligible for Medicaid, but you may be eligible for Medicaid. We will talk about that in a second. You cannot lower your premium costs if you bought directly from an insurer unless you have a magic wand or some kind of magical powers. Next slide, please. So to lower your premiums, you're going to recalculate your income. And there are two basic ways to do this. So you can either use your adjusted gross income from prior year's tax returns, or you can estimate 2020 income based on what's happening right now. So when you go into healthcare.gov, they're going to ask you to estimate your 2020 income. And they will accept line 7 of your 2018 tax return or line 8 of your 2019 tax return as an estimate for 2020. So if that is beneficial to you, then you might want to use that income estimating way of estimating your income. Next slide, please. However, here in 2018 and 2019, and like most people, you are not having such a great year right now, then you will want to estimate your income different. If you lost your job and income abruptly, and you qualify for unemployment benefits, you're going to add up the following, okay? So you're going to add up your gross W-2 income to date. So the last, if you look at your last pay stub, your year-to-date gross, you're going to include any kind of net self-employed income. So from self-employed income, which is 1099 income, you can deduct business expenses. You cannot do that from W-2 income. So W-2 income is gross, 1099 income is net business expenses. You're going to add up any other sources of income that you have, and you're going to include your unemployment benefits. Now, the new thing is that people who are self-employed do qualify for unemployment now through the new pandemic stimulus program. So that's how you're going to re-estimate your income, particularly if you have nothing going forward. Next slide, please. Do not count the $1,200 check if you actually happen to get it. Congratulations, but do not count the $1,200 check as income. You do not need to do that. You do not need to include any kind of cash income up to $14,000. That's an IRS regulation. You don't need to include that. And the stimulus payments do not factor into the ACA application, which means that $600 a week that does not need to be added into the application, okay? So these are key points. So I'm going to stop right now and see if anybody has any questions. And if instead of typing into the chat, if you wouldn't mind just unmuting yourself and ask a question, that would be awesome. No questions? Okay, I guess we'll move forward then.
Mindy, were you trying to ask a question?
I was thinking.
Okay.
Because, I mean, one doesn't know what's going to happen, but what happens, and I wrote this down, if my income is under 12,500? I mean, I don't know. I mean, we don't know what will happen this year.
Amir can answer that question.
Okay.
Yes, absolutely. So There are a few different routes that you can take, and we'll talk about them in the slides to come. Essentially, for folks that are between 0 to 100% of the federal poverty level, they are in what's called the Medicaid gap, unfortunately. And so if you were below that amount, there are different programs, one of which is very similar to the Grady program that they have available throughout at different hospitals and medical environments. Programs that individual hospitals give access to Georgia residents to might be one option. Urgent care centers is another possibility. Federally qualified health centers are other places to go for care. But unfortunately, we do have in our state a segment of our fellow residents that are going without coverage as far as the ACA and subsidies.
Okay, I'm just going to jump in here real quick,
Thank you.
Mindy, because
Mhm.
there's a very good chance that your income will be over because almost everybody qualifies for that $600 a week payment through the end of July. So
Yes, yes. I don't think I will be above that. I was just, just my mind was just going,
Sure, yeah. So I just want to underscore though that a lot of people think that they're not eligible for unemployment or those weekly pandemic payments, but that's not the case. Most people are eligible. So if you're normally eligible for unemployment, you would get unemployment plus the $600 a week. If you're normally not eligible for unemployment, you would get the $600 a week. The people that are normally not eligible for unemployment are the self-employed people. Those are the people I'm talking about. There are a few categories of people that will not be eligible for anything, including undocumented immigrants, but for most people, they will be eligible for these payments. The unemployment payments will go through the end of the year. The $600 a week payments will go through the end of July. I don't know if they will extend them at this time or not, but it is so important for you guys to go on the Department of Labor website or however you guys are doing it, just get your applications in because it's quite a process, but eventually you'll get money.
Right. I would also add to that the way that the marketplace records and documents income is that they're looking at the entire year. So in the event, what you projected a couple of months out, you didn't receive, or you went above and beyond that, you have the opportunity at that time to update your application for health insurance coverage via the exchange. And I often encourage people that are self-employed to update their income information, because if you are eligible for a subsidy and you go higher or lower than that projected income, then come tax time, that money gets reconciled, meaning you may get more from the IRS or you may get less based upon what you provided in that marketplace application.
At a point when your income is really changing, it's worth it to go back into your account and make those changes as needed.
Absolutely. So now we have arrived at a brief comment or two about Medicaid. I reference the Medicaid gap, but this slide highlights who actually is eligible and who could be deemed eligible for Medicaid coverage. Know that as well on healthcare.gov, there are a few questions on the application directly related to Medicaid enrollment or Medicaid eligibility. And upon the end of the application, you'll receive a notice from the marketplace in the event you are eligible for Medicaid to know that your ACA application is being directed to the Medicaid office that is appropriate for your section of the state in Georgia. The website below also is worth checking out should you think you might be eligible, because those applications can be submitted throughout the year. There is not an open enrollment or special enrollment period for Medicaid. Next slide, please. Great. So we just talked for a moment about what our choices are should we not be eligible for Medicaid and our income is below the 100% FPL. There are free and sliding scale clinics that are available to folks. If you are living with or are impacted by HIV or AIDS, there are AIDS service providers that will assist and can assist you. There are also Ryan White programs that are available for folks that are on the lower income strata, if you will, as well as community health centers that you can access. Next slide, please. I touched on both of these programs briefly. The Grady card is available for Fulton and DeKalb residents, which allows you access to all of Grady's health centers if you are in those appropriate counties in the metro Atlanta area. There are other hospitals such as Gwinnett Medical that have a similar program as well. Dari, who is listed on this slide, is a member of our enrollment assister team at the Health Initiative, and she can guide you through that application and through that process. There are federally qualified health centers throughout the state, and they provide services on a sliding scale. So I invite folks, should they be interested, to take a look at that website for more information on the FQHC that is closest to you. Next slide, please. Thank you.
So I am going to talk just briefly about the Kaiser Permanente Bridge program. And this program is uniquely available to people who do fall within that Medicaid gap. This is a program that C4 Atlanta is able to offer as a community partner with Kaiser Permanente. Now, just to be clear, we are not offering insurance. Kaiser is the one offering insurance. It is their program. But because of our relationship as a community partner, we are able to extend this program to folks who are members of C4 Atlanta. You do have to be a member of C4. There are several other requirements that you have to meet in order to be able to apply. There's an income eligibility requirement. That's usually the biggest barrier for most folks. It is that 100% of the federal poverty level. It does include your dependents. So if you have dependents, you do get a little bit higher amount if you have other people that you're responsible for. You also have to be a resident of Kaiser Permanente's 24 county region. You have to be older than 18 and younger than 65 in order to be able to apply. And you also have to have taken a class with C4 Atlanta, and this is part of Kaiser's requirements as well, that you have taken a training with the community partner. They view this as a workforce development program, so they're looking at how can we cover people during periods of transition. And so if you are trying to, going from one situation to another and trying to improve your situation, they want to help cover your healthcare coverage during that transition to make it easier for you to get education and maybe build your business as an artist, or take some kind of class to help you out. So there are 4 multi-week classes. Sorry, we just added a new one. 4 multi-week classes that C4 offers that you can take in order to be eligible for Bridge. So you have to be a member, you have to have taken a class program. And then the other requirement is that right now, this program is only available during open enrollment. We did ask our Kaiser representatives when all of the COVID-19 closures happened, whether or not they were considering opening up for a special enrollment period, and they said at this time they are not. So this is a program that is only available during open enrollment. What's wonderful about this program, I see somebody said, I did the Bridge program a while ago and it's awesome. What's great about this program is that if you are eligible, and again, I will drop the link for the website into the chat so that you can check and see those eligibility requirements and see, am I eligible for the program, am I not? If you are eligible, it will cover, there is a subsidy that Kaiser will offer to you that will cover your monthly premium and your co-pays as long as you're staying in the Kaiser network. If you're out of network, it is a different pay structure. So it's best if you're on that program, if you stay within in network for up to 12 months. Right now, they are looking at offering an additional 12, whether or not people can reapply for an additional 12 months of coverage. Prior to this year, people were eligible for 24 months of coverage, but because Kaiser's programs changed at a national level, they had to change how they offered it regionally. So right now they're only offering for sure 12 months of coverage with the premium fully subsidized, and then potential for renewing after that 12 months for an additional 12 months. So that could be up to 24 months of coverage. What does it cover? It is basically a Kaiser Gold plan that you can go and buy on the ACA exchange. They offer it right now. It's the same plan. The difference is that if you are on the bridge plan program, then Kaiser covers the cost of your monthly premium and they cover that copay for you. So it's the same insurance that you can get on the marketplace right now. It's really, really good insurance. And again, the only change being that Kaiser offers that subsidy to people on the program to help them pay for it. But the coverage level is the same as an ACA Gold plan that you can buy right now. If you have any questions about that program, the open enrollment will come around in November, and probably sometime in October, C4 Atlanta will offer some information sessions, usually one in October, one in November, around that program. You can also email me directly. My name is Audrey at c4atlanta.org. That's my email. Or you can email Morgan Carlisle, who is our new member services manager. This is her program, and so this is what she does every day. And her email is morgan@c4atlanta.org for more information about that. The reason that we're sharing this with you is, and even though you may not be able to enroll in it now, if your situation is still not improved by the fall, or if we're still kind of in the same situation we are now, we want to let you know that this may be an option for you if your income is still reduced and you meet the income requirements. And one thing that's great and about this program is that they look at your income either monthly or yearly. So if you have not, if you had a really great year last year and your taxes show that you made, let's say $100,000, but then you lost all your gigs for this year in the last few months, and you just have really had a poor year, they will look at your current situation. They're more interested in that than they are what you made the previous year. So just keep that in mind. If by November you're still in a place where you're not having a lot of work come in, income hasn't picked up for you, this might be an option to look into.
Okay, so I'm going to talk a little bit about some of the junk insurance plans that are available right now. And I just want to note that these are plans that don't follow the ACA regulations. These are plans that you might see online or you might get an email about. They're really fishing for clients right now because they know that some people are uninsured and they might be tempted by something that isn't really beneficial to them. So there are different kinds of plans that veer from the ACA model that we were talking about earlier. There are association health plans. That means you're part of an association and you get certain membership benefits, including health insurance. There are short plans. So those plans are 1 year long minus 1 day. Short-term plans are not regulated through the there are faith-based share plans, and I'll talk about those in a second. Plans have in common is they can charge you more based on your health insurance status, on your health status, and charge you more, for example, if you have diabetes or heart disease. There is no cap, there's no out-of-pocket maximum. So you might end up paying $90,000 even though you have health insurance because there's no out-of-pocket max. They don't have to cover essential health benefits. They don't have to cover medications if they don't want to. They don't have to cover hospitalizations if they don't want to. I saw a short-term insurance plan that only, not kidding about that. So
I think, could you repeat what you just said? I think
they don't have to cover pre-existing conditions, and they can't retroactively cancel you if you get sick. So once you try to use that insurance because you got sick, they can cancel you and not. To find a regulated plan you want to go to healthcare insurance commissioner's website, okay? Those are the places to find regulated plans. Don't be tempted up online or in your email. And if you are, please contact either Amir or myself before you sign up for one of these plans. Next slide, please. Oh, everything is kind of, oh, there we go, okay. All right, so faith-based share plans. I know that these plans are popular right now. Basically, it's people of one faith coming together, whether that's Christians or Jews or Muslims, to pay each other's medical expenses. Most of these plans do not cover major benefits, including mental health or dental or medication. So you need to read them very carefully to see uncovered expenses, which can be low. Say we will cover hospitalization up to $100 a day. So if anybody knows anything about the cost of hospitalization, they're going to be a lot more than $100 a day. So you want to look at those caps, see if those caps are reasonable or unreasonable. Costs include, they don't have to cover pre-existing conditions. So, and some of them actually do say that. But they don't have to cover pre-existing conditions. Costs include an initiation fee or an enrollment fee. So you have to pay that up front where you get into the plan, and then a monthly sharing fee, which is similar to a premium, but it's not called a premium. The thing to really understand about these plans is they are not required to be solvent or have any reserve funds. Insurance plans are required to be solvent and have reserve funds. These plans are not. So if you pay into a faith-based share plan and then something happens to you, you have no legal recourse to sue because they are not regulated by insurance commissioners or departments of financial services, and they are not required to have any money in the. I want to be clear about that. If you do get involved in these plans, what you're possibly involved in. Next slide, please. So signs that your insurance might not be regulated include initial. Like you can see it anywhere. If it has the phrase not major medical, that means it's not comprehensive insurance. So if you see that phrase, you know it's not going to cover essential benefits. It's not comprehensive insurance. And also, if you see something that says discounts of up to a certain amount, that's pretty shifty. So it's very difficult to know what you might end up spending. And often those discounts might end up being 10%. So if it says discounts of up to 90%, and then they decide to only discount the stuff 10%, you really have no recourse. So really read the information that you get. I know that a lot of people jump on these because they think it sounds like a great deal and they lucked out and they found something nobody knows about, but these plans are usually not in your best interest. Next slide, please.
So, excuse me. So this slide is included because part of our work at the Health Initiative is to assist queer and trans folks as well as individuals that are impacted by HIV and AIDS as it relates to the Affordable Care Act. And so we wanted to share this slide today in the event you or someone you know may have Ryan White or HICP as forms of assistance for your healthcare. Both of those programs, meaning Ryan White and HICP, are specifically for folks that are impacted by HIV and AIDS. And I just want to make the distinction that Ryan White is not comprehensive healthcare in the sense that all the 10 essential health benefits that we talked about earlier this afternoon are not covered by that plan and by that program. So looking at the whole body, if you will, the exchange plans are available for that specific purpose. And HICP is one of those programs that offers assistance with paying for your monthly premium should you be living with HIV or AIDS. And so there are ways to get off Ryan White and have comprehensive coverage and still keep it affordable. Unfortunately, for those with this chronic condition, the cost of medications are quite high. There are, however, resources available to make those costs not as high. So at the Health Initiative, we do have folks that are very skilled in supporting this part of our community and often will lend resources and services during open enrollment. The other thing that I'd like to mention as well is that enrollment assisters with the Health Initiative, we have an open door policy, and as such, we help any and everyone to the best of our ability should they need health insurance assistance. It is our current mandate to particularly support and affirm those communities that I just mentioned. Next slide, please. All right. So here we have.
We talked a little bit earlier about how to get coverage or how to get care. This website, essentialhospitals.org, of the hospital scale. Click on our members and see what hospitals in the Atlanta area. We'll see people who are. Amir mentioned earlier to find a healthcenter.hrsa.gov. So that's where you're going to find your community health centers. And then for people, I'm so sorry that I'm going in and out. I'm not sure what to do about that right now. My internet is just acting crazy right now. But if you are medications, know that you can compare the cost of medications at goodrx.com. That's not a scam website. It's a website that is promoted by Consumer Reports, and you can put the medication in that you are looking for. Let's say you're having problems sleeping and you're looking for Lunesta. You type in Lunesta and it will tell you all of the pharmacies in your area and what they're charging for that medication. And you are going to be shocked because Costco might charge $15 and Walgreens might charge $400, and it's the same medication. So you definitely want to shop around. If you're uninsured or if you're insured, you want to go to this website and check out what the costs are at the different pharmacies close to you. Shop around for the best deal. Needymeds.org is a website that lists all the pharmaceutical assistance programs. So drug companies give their drugs away for free to people who are uninsured and have low incomes. I would really recommend that anybody that's uninsured and has an income below roughly $50,000 a year, because that's what most of them consider low income, that you check out needymeds.org, because you can get your medications there for free. It's basically a database of all the pharmaceutical assistance, and there's nothing better than free. Next slide, please.
Did I click on something wrong?
Well, this is great. This is essential.
Well, while you're clicking, I can share right quick on the topic of medications and costs. If you are insured and you are insured via the exchange, every available insurance for you and for your application will include a drug formulary or a drug list. It's very much so prudent to take a look at that before selecting your plan to make sure you know at what percentage your medication is covered, or if you have a generic option, what that would be and what level that would be. There are 4 tiers for medications on the exchange, tiers 1 through 4, and 4 is the most expensive and tier 1 tends to be the cheapest. So again, while you're looking at options, or if you're considering options for plans that you find useful, know that the drug formulary is a place to look to make sure that the meds that you are currently taking are covered by the plan that you're interested in. Great.
Thank you, Amir. So we just have 2 more slides, this one, and then Amir's going to wrap up with some local resources. So I think my connection is a little bit unstable. Testing is according to the terms of your insurance. If you're uninsured, treatment is also free. So for COVID-19, testing is free for anybody insured. According to the terms of your insurance, $500 for hospitalization, and you end up getting COVID-19 and end up in the hospital, you would pay $500 for that hospitalization. So you have to look at the terms of your contract, of your insurance, to see what your copays would be for hospitalization or surgery or home care, anything like that. The administration announced that treatment would be free for people who are uninsured, but they didn't say how that was going to happen. So right now we don't know how they're planning on paying for people who are uninsured and receiving COVID-19 treatment. We just know that they set aside money for it in the stimulus package. So it's probably going to go to the hospitals who are treating people who are uninsured. And the last slide, please.
All right, so I'll take a moment just to share additional resources for enrollment help as it relates to the ACA. Out to Enroll is a partner of ours that has a network of enrollment assisters that are available and can be called upon should you need someone to guide you through the process of enrollment. They're based in DC, however, they have a national network, and they also connect folks living here in Georgia and beyond to other enrollment assisters, or answer questions as well. I would recommend checking out their website if you have just general, general questions, or if you want to bounce additional terms and concepts. Their glossary is very helpful and it's very useful. I've often shared it with folks who may not remember all the terms, or they're confused about certain terms as it relates to healthcare or health insurance. Georgians for a Healthy Future is here, based in the Atlanta area, and they are an advocacy group. They have done quite a few public policy papers and advocacy as it relates to lobbying for more accessible coverage for all Georgians. Georgians for a Healthy Future used to have navigators and certified application counselors on their staff. However, they do not at this time. They are a part of a coalition called Cover Georgia. Cover Georgia is working to expand Medicaid access here in our state, and I often share with folks that if there is a concern or if there is a need, looking at Cover Georgia can be useful to know what you can do in terms of plugging in to ensure and increase the access for accessible coverage here in our state. And then the other one is us, the Health Initiative, which I've spoken about a couple of times, or more like a couple of 3 times this afternoon. So know that we are available and that we, again, have an open door policy. And as such, we are accepting appointments now. We are taking appointments now for people to complete their health insurance applications. And in the event we need to reach out to other colleagues, we are happy to do so on your behalf to answer any questions that you have about the ACA or the ACA as it relates to COVID-19.
So we are done. Does anybody have any questions at all? Are you confused? Are you understanding a little bit more? Do you have a question specific to your situation? We're so happy to answer any questions right now that you guys have. So just go ahead and either raise your hand or unmute yourself.
I'm unmuted. I don't see where to raise my hand.
Okay,
it's Robert
go
here.
ahead.
My previous experience with the Affordable Care Act in Illinois, I found it difficult to find a healthcare provider that would take the insurance that was legit. Is it the same way here in Georgia?
I'm going to let Amir answer that question.
Sure, I was just unmuting myself. So Illinois, like California and New York and here in Georgia, when the Affordable Care Act was rolled out or the inaugural year took place, all of those states, i.e. the whole country, had the ability to determine how they would roll out the actual experience and process. Georgia is using a federal-based model and the federal exchange. Some states are using a state-based model for how they actually implement the Affordable Care Act. Other states are using a hybrid, if you will, or one of both of those options. So as it relates to coverage in Illinois versus Georgia, you're looking at two different platforms and two different ways in which to access healthcare and coverage. For folks that have moved from one state to the next, typically there's a certain amount of time in which their special enrollment period is available and is offered to them. So in the example that is being provided, you can look up providers or look up counties where there are different insurance companies that you're eligible for to consider where your application should go or consider what doctor you want to take that takes that insurance. In the event you are searching for a specific doctor, or if you are looking for a particular type of specialty care, there is a way to do that before you actually complete your application. And if you would like to use my contact information, which is provided in the beginning of the chat, I'd be happy to talk to you more specifically about it. But every state is different in terms of how they're actually implementing the Affordable Care Act, which is why there probably was a discrepancy as it related to how to actually find someone that would take your coverage.
Thank you.
Thank you.
And if I could also mention, just kind of really quickly, that in addition to looking up your doctor, there is also a tool on healthcare.gov where you can look up your prescriptions as it relates to plans that you're considering. If you're on a specific medication and you want to make sure that your plan covers your medication, you can look that up on healthcare.gov as well.
Anybody else have any other questions? All right, well, if nobody has any other questions, again, you can either reach out to Amir for local enrollment help, or you can reach out to Debbie at our office for Medicare assistance, or you can reach out to one of our navigators if you have friends or family members that need enrollment assistance elsewhere outside of Georgia. We're happy to help. Just a reminder that, thank you for the nice words in the chat, and just a reminder, again, the Actors Fund does have financial assistance. Don't be shy about applying for it. We generally are getting a turnaround of a couple weeks to get people checked. There are some eligibility criteria. You do have to meet those criteria. So if you want to go to actorsfund.org/MIEligibleHelp. I don't know why it's MIEligibleHelp and not for help, but that's what it is. There's also a banner on the website, and go ahead and apply, and we'll see if we can get you some money during these very difficult times. So,
yeah. I just want to say thank you so much to Amir and Renata for spending their time with us today. That was very informative, and actually I learned several things while we were on this meeting as well. Our plan is to, we have recorded today's session, so our plan is to share this too on our blog at some point. So hopefully if you have friends who weren't able to make it and you want to share, you're like, oh, this is such a great information, you could share that link with them later. So once we have that up, I'll send that out to everyone who is part of today's session in case you want to share that with other friends. But thank you again to Amir and Renata for spending your time with us, and thanks to all of you for participating as well.
Thank you.
Yeah.
Bye.
Bye.
Bye, everybody. Thank you.
Thank you,
Stay safe.
everyone. Thanks for having me. Bye-bye.